Hello and welcome to Digital Medboard. Here we go. A 30-year female patient has presented with a swelling in the groin region. The swelling disappears completely through the deep inguinal ring, producing a gurgling sound. This is most likely a case of. Before answering this question, let's view in detail. Although femoral hernia are most common in female, inguinal hernias, particularly indirect inguinal hernias, are still most common even in female. In this case, the patient presents with groin swelling that disappears completely through the deep inguinal ring. This indicates that the hernia is passing through the deep inguinal ring, confirming it as an indirect inguinal hernia. Indirect inguinal hernia are congenital and often results from a persistent processus vaginalis, which allows abdominal contents, such as intestines, to protrude through the inguinal canal. You might wonder why a persistent processus vaginalis occur in females, as they do not have testes. The reason is that the round ligament of uterus, which is a structure passing through the inguinal canal, is associated with this condition. Though indirect inguinal hernias are rare in females compared to males, who have larger inguinal canals to accommodate the descent of the testes, but still can occur in females. The presence of a gurgling sound suggests the involvement of intestines, indicating an enterocele. Since the question specifically mentions the deep inguinal ring, the correct answer is option B, indirect inguinal hernia. If you found this video helpful, don't forget to like, share and subscribe to Digital Medboard. Got questions? Drop them in the comments below. See you in the next video. Until then, stay tuned. Cheers.